Hi everyone, welcome to Evolve 101 with Dr. Inaka Yembe. In these videos, I'll share with you some medical information that you can use at home for your health and your well-being. I must say that the information that I give you is not a replacement for your doctors or your medical care providers' advice. So today we will continue our talk about diabetes. Specifically, we'll be talking about the symptoms of diabetes and how your doctor or your medical care provider diagnoses you with diabetes. Diabetes is one of those diseases that can affect our whole bodies. It is characterized by high blood sugar. So sugar in the blood is elevated. What are the symptoms of diabetes? Some people actually have no symptoms whatsoever. Some people have very mild symptoms and some people have a lot of symptoms. So some of the symptoms of diabetes include number one, urinating often, so frequent urination. You're going to the bathroom more than you even drink, and then you drink water or anything else, you run to the bathroom even more. That could be a sign or a symptom of diabetes. Another one is feeling very thirsty. You drink water or drink fluids and it feels like you are still thirsty. Another one is feeling very, very hungry. You eat and you still feel hungry. Other symptoms include just feeling tired, your vision is blurry. That's a very important symptom or sign not to ignore. If you look around and it seems like you have blurry vision, you just cannot see clearly, that could be a sign of diabetes. Sometimes you may have a cut, you're walking around, you step on a stone, or you go to the farm and you cut yourself, you come home, that wound does not get well. That could be a sign of diabetes also. Diabetes causes our wounds to not heal as fast as they used to. Another big one is just weight loss. You're eating more, and this occurs mainly in children, but in adults also. You're eating food, you seem like you're hungry all the time, you're eating a lot, and you're not gaining weight. In fact, you are just losing the weight quickly. That could be a sign or a symptom of diabetes. Other people have just burning or numbness and tingling in the fingers. Most of the time it may start in your fingertips, in the tips of your toes, and then they feel numb, like they're going to sleep. They feel like they're going to sleep. You cannot get good feeling in them. They feel like they're tingling, like you have ants or needles rushing up and down your fingers and your feet. That could be a sign of diabetes also. If you have any one of these symptoms, blurry vision, feeling thirsty, running to the bathroom and urinating all the time, you're eating but you're still feeling hungry, your wounds are not healing, you have an infection that is not getting well, I encourage you to seek medical care quickly. Now, if you even suspect that you are diabetic, and let's say you are in the village, you cannot get quickly to somewhere to get care, what can you do to help yourself at home? Number one, we need to cut back on starches. Starchy foods like fufu corn, potatoes. If you suspect that you're diabetic and you just cannot get quickly to get help or to get tested, start cutting back on your starches. So just don't wake up and continue to eat that big bundle of fufu, continue to eat bread, continue to eat potato, continue to eat corn, roasted corn. Don't keep drinking Coke, Sprite, palm wine. All these things have too much sugars or starches, and they may only make your condition worse. So if you have trouble getting to seek care soon, some of the things that you can do at home are just cutting back on those starches. Drink plenty of water, and if you fetch water from the stream or if you collect water from the rain that fell, then don't drink it without boiling it. Always boil your water before you drink it. very, very important. So if you suspect that you are diabetic and you're still finding a way to go to the hospital to get a test, the first thing that you can do on your own is to stop eating too many starches. Just eat your jamsu, or eat okra, or eat your bitter leaf without eating the fufu or the cocoyam or the potatoes. Don't eat bread and tea. That will make your blood sugar go up even higher if you are diabetic. We don't know yet if we are diabetic. We're still trying to go to the hospital. So what we need to do is drink water. I know you will be running to the bathroom, but we need to keep drinking as much as we can. And remember, water that is fetched from the rain or from the stream or from the well, make sure you boil that water first, because we can become sick from drinking water that is not boiled. If you buy it in a bottle like Tangi already, that's good. You do not need to boil that water. So now that you have been able to get to your doctor or to the dispensary or to the healthcare center, how do they diagnose you with diabetes? Number one, they would listen to you. What kind of problems are you having? That's one thing. Remember your family history. If you know that your mother or your father or your brother or your sister had diabetes, you want to tell your doctor also, or tell your nurse. Now, tell your nurse all the problems that you are having, everything. It's important to tell the doctor or the nurse all the problems that you're having, because this is what will help them to diagnose you with diabetes. In addition to that, they may also prick your finger and get a drop of blood, and that is how we check you for diabetes, just with a finger prick. Another way to check you is actually to put a needle in your arm or your hand and draw your blood and send it for blood tests. But most importantly, please remember to start helping yourself at home. Cut back on starches: corn, potato, cassava, cocoyam, rice, bread, sugar. Don't drink tea and put sugar and milk. Just put the milk only, or drink the tea just like that. Drink water, lots of water. Boil it. Don't go out and buy beer or sha or palm wine, because all these things have more starch. Just drink water. If it's from the rain or from the stream, boil it. Always boil water that is not bottled. Boil it before you drink it. So again, those are the symptoms, and that's how your doctor will diagnose you, either by doing a blood test or by pricking your finger with a needle and getting a drop of blood, or by doing both. I hope this information helped you. If you missed the definition of diabetes or what can put us at risk of developing diabetes, I encourage you to go to my YouTube channel, subscribe to my YouTube channel, and hit that notification button so that each time I put out a video like this, you will get that video. And you can also go back to my YouTube channel and watch video number 1 of this diabetes series that talked about the definition and the risk factors of diabetes. Thank you.